Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, and I'm really excited today to bring on one of our brand new partners and introduce her to our network, Miss Mags Palma. How are you today?
Good. How are you?
I'm good. Thank you so much for asking. Now, I want to just give you an opportunity to tell our viewers a little bit about yourself and say
hmm
Seniors First Home Care, how you got into the industry, what brought you down here to Southwest Florida.
Great. Well, thank you very much again for your time. I'm delighted to be part of your team, and thank you again for the introduction. I'm Max Palma, and I'm the owner and CEO of Seniors First Home Care. My husband and I moved to Naples with our two young daughters to start a home care business. We looked after my mother for a number of years, who was diagnosed with terminal breast cancer. And really, that was the reason that inspired us to start this in the first place. During the time of her cancer, we realized that a lot of people don't have relatives nearby. And as you're sick and getting old, you need a lot more assistance, especially if you have cancer. And with my mom, we realized that we started to reminding her of taking her medication, taking her to doctor's appointments. And even though both my husband and I have healthcare backgrounds, we found it challenging at times to navigate through all those things ourselves. So that really was the reason why we decided to start a home care business, and we wanted to start it here to Southwest Florida with our young two daughters. So we couldn't be happier to have moved here and to start this.
That's great. Tell me, well, first of all, condolences on your mother. And I will say that being in healthcare, I think we always preach to the choir on what we should do and how we should handle things. So it's really interesting, when the shoe's on the other foot and you're either the
Yeah.
caregiver or the patient, because we're the
Mm,
worst patients too, aren't we?
absolutely. Yeah. We learn a lot. And I think that's really, sometimes, as you said, we don't see things until we are in those shoes. And that's when we realize that, there were a lot of people out there that, they don't have relatives nearby. They don't have anyone that's looking after them. And we wanted to make sure that we were looking after the most vulnerable.
Yeah, and honestly, that goes for the young and the old, which I'm sure you don't wouldn't turn away someone like your mom's age to take care of. Uh,
No.
Interesting story myself. I was single and living alone when I had foot surgery, and being in the industry, it took a little while for me to register, and I'm like, oh my gosh, why am
hmm
I not using home care? So, at 30 years old, I was using home care because I was bedbound for
Yeah,
14 days. So I totally,
absolutely.
totally get it.
Yeah, and you're right. It's not just providing care for seniors. As you mentioned, is providing care for all adults. Seniors included, in any need of assistance of activities of daily living. So, it could be someone that's 35 and needs help with things like bathing or grooming because you had foot surgery and now you can't do that yourself anymore. You need help.
Yes, absolutely. Well, you
Mhm.
mentioned that you and your husband had a background in healthcare. Why don't you tell me a little bit about that so we can get to know you?
Okay. So we moved from Pittsburgh, Pennsylvania, and I was working for a academic medical center there. It's called the University of Pittsburgh Medical Center, and we, I have an operational role. My husband is a radiologist by background, but my day-to-day responsibilities, including looking after the clinical operations of a tertiary hospital. So I was responsible, like I said, for all the operations of the hospital, looking after all the quality improvements. And so I have a lot of experience interacting with patients on a daily basis, with their relatives, also, working with the staff members and the physicians in the hospital environment. So I think all of this is of great benefit to me now, because what I've tried to do here, which is a little bit different than the competitors out there, is that I've surrounded myself with people who have a clinical background. I think that's really important and key in this business, is to make sure that you have clinically knowledgeable people within your team, so that when you go to someone's home to conduct an in-home care assessment, uh, you go with the clinical eyes on it, and you set up a plan of care for the client that is in line with, you know, their needs and their recovery goals. What we want to do is we want to help seniors and other adults, you know, achieve their goals, and making sure that they live as independently as possible for as long as possible, so that they have a very good quality of life.
Yeah, and you actually hit the nail on the head. A lot of times when I do these talks, I ask, to talk about what a care plan is and how you
Hmm.
you make sure you're not only meeting their expectations when you have a really well-designed care plan, but you're also meeting your expectations for that client. So everyone is
Hmm.
happy and you have a plan outlined.
Yeah, exactly.
Now, I know that you're entering this market as an agency. Do you want to talk to us about what that means exactly?
Yeah, so that's a great question, because we do get a lot of phone calls, and unlike what we call nursing registries out there, an agency is actually insure bonded, and we have obviously the license to provide this business in Southwest Florida. And what differentiates us between the nursing registries out there is that we employ our caregivers, and that's really key, because we make sure that, first of all, we go through extensive background checking on anyone that we hire, and then that they get the appropriate level of training before we would actually put them with any client of ours. And so that's really key. And once they're working for a client, we do routine supervision. So we are constantly making sure that the caregivers are working in accordance to the care plan that we have designed for that client. Unlike nursing registry, where they'll just hire anybody and then, you know, they just send a warm body to somebody's house, we don't want to do that. We want to make sure that the people that we hired are trusted uh, caregivers that we're going to send to someone's home. And like I said, our employees are insured and bonded, so that's a really peace of mind for the client to know that when we send someone to their home, it's someone that they can trust.
Yeah, perfect. I appreciate you giving that distinction between the two. A lot of times people will ask, "Well, what's the big difference in price? Like, why is
Mm,
why is it more expensive with one versus the other?" And it's
yeah,
the fact that you guys are paying for the additional licensure and
we
fee.
do. Yeah, we have to pay for workers' compensation. Our employees, obviously, we make sure that, you know, we have workers' compensation, we have liability insurance. And so sometimes the clients don't realize that, you know, if they go with a nursing registry, they might pay a little bit less for someone to come to their home. But if something happens while they're at the client's home, it is the client's responsibility. So if that caregiver gets hurt on the job, the client will be responsible for paying for anything that goes wrong in that home.
Yeah, absolutely. Well, thank you again for the designation between the two. I know that there is a lot of valuable information, and we do a ton of different educational events that you'll be a part of in the future to talk about the differences between, say, home care and Medicare certified home health. But do you just want to
Mhm.
touch on what services that you do offer and how it differentiates from needing a doctor's order?
Yes. So basically, we provide what's called personal and companion care. So we provide assistance with what we call activities of daily living. Those can include bathing, grooming, light housekeeping, laundry, shopping, meal preparation, reminding our clients to take their medication, taking them to their doctor's appointment. So, in essence, you don't need a doctor prescription in order for you to have personal and companion care. Anyone at any point of time can decide for themselves that they want to have personal and companion care. We obviously can work with every single one of our client. We have a contract with the VA, so some of our clients actually are veterans or spouses of deceased veterans. So we can work with anyone from the VA, and as well as we have contracts in place with other agencies that contract directly with the government, so they have Medicare and Medicaid, and they refer the home care business to us.
Okay, so you're contracted with Medicaid and the VA?
Not us directly. We contract with agencies who have those contracts in place with Medicare and Medicaid. So as long as you have Medicare and Medicaid, we can refer you to the agency that will outsource the home care services to us.
Got it. Perfect. Thank
Yeah,
you for clarifying.
yeah.
Okay, wonderful. Well, I'm just so happy to have you in the network and to introduce you to all of our viewers out there for SBB Live. And until next time, Mags, I hope you have a great day.
Thank you so much for your time again. And if anyone needs any home care, don't hesitate to give us a call.